What's going on, student nurses? Thanks for tuning in to A Couple Nurses. My name is Cordero. Our goal with this channel is to share our experiences and share with you guys tips, tactics, and strategies that can help you perform at a high level while you're in nursing school. Today's video is going to be building on the 5 fatal mistakes that nursing students make. Today is going to be topic number 3, which is going to be being scared to mess up. Alright, so before we get into the video, remember, if you find any value with the video, give it a thumbs up. If the video is whack, give it a thumbs down. Comments, questions, suggestions down in the comment box. And if you do enjoy and like content like this, be sure to write Nurses Rock in the comment box so I know that I continue making things like this. And also, if you like any kind of tip, tactic, and strategy delivered directly to you every week, we do have study hacks that we send out every week. So if you want to be a part of that, be sure to subscribe with the link that I have below. Alright, so we're building on the 5 fatal mistakes that nursing students make, right? So we've already went over number 1, which is waiting. Number 2, which is lack of communication. And fatal mistake number 3 is going to be being scared to mess up. Alright, so this is something that I think is huge. A lot of people are afraid to mess up in school, and it's okay. If you're anything like me, you have no health background at all. So, I mean, even touching a simulated dummy kind of feels weird, you know? And when you get into clinicals, it feels even more weird to actually be caring for somebody. Okay, so, but it's okay to mess up. That's why I want you guys to understand, like, getting better requires that you fail. Because if you don't fail, you don't know how to get over that. You know, and that's with anything in life. That includes nursing school. All right, so you just have to put yourself out there sometimes and just do it, you know, and learn from where you mess up. You miss opportunities to improve your skills. All right, so it's like if I still haven't mastered the art of starting an IV, okay, and I've tried it maybe 3 times, and I've only been presented the opportunity about 3 or 4 times. So I've taken each opportunity, and I've messed up each time, but I know eventually I'm going to perfect that. Okay, one thing that I did do the very first time really well was insert an NG tube. So I remember my first time doing NG tube. I remember doing it on the dummy. I was like, oh, this is hard. I did it on an actual man for the first time, and man, he looked so uncomfortable. Like, he was like choking, acting like he was finna die, like asking me to take it out of him. But he had his abdomen was huge, and we needed to do some gastric suctioning to get that out of there. So I knew that it was important to place that. And I had to explain that to him, and you know, I just went in and did it. You know, very first time, did it, saw that, you know, aspirated, heard the swoosh in the belly, all that, and it was a really cool experience, you know. But if I'd been afraid to do it, then I would have never known that I can do it, you know. And that goes for a lot of the skills, especially when you're in your med-surg clinicals, you know, whether you're inserting a Foley catheter or you know, giving your medication for the first time, or even patient teaching. Just put yourself out there. If you mess up, dude, it's okay. We're not licensed yet. So, you know, we don't, I guess you, quote unquote, we don't have that risk of putting ourselves at danger like that. But of course, be supervised, not saying just go rogue and do whatever you want to do. But what I'm saying is face your fears, because we're going to be faced with a lot of situations when we get into a professional career that are going to be frightening, and we're just going to have to suck it up and do it. You know, if you don't understand, then ask somebody around you. You know, more than likely you're going to be surrounded by people that are more informed and have more experience than you do, and they can possibly give you that confidence to just do it, man. Seriously, sometimes I get to clinical simulation labs and everybody's scared to be primary nurse. Dude, I raised my hand to be primary nurse. First off, because I want to get it out the way. I'm going to have to be primary nurse anyway, so might as well get it out the way. And secondly, because I want to show that I have leadership skills. You know, as a nurse, we're expected to be leaders. You know, the patients and their families look at us as a leader. So you need to also look for opportunities to develop that leadership skill and show that you have confidence in the information that you've learned. You know, we're not learning this for no reason. You need to actually be able to apply the information that we learned. What else do I have here? Again, that entails lack of confidence. So when you're scared to do things, you're less confident about it. But you know, continue to fail, and you'll eventually get good at it. All right, and like I said, that's with anything in life. Everything that I usually talk about has a direct parallel with real life situations. You know, whether you're talking about sports or whether you're starting a new job, you have to put yourself out on the line and don't be scared. But that's it, man. We're gonna keep it short and sweet. That's fatal mistake number 3. So tune into our next video, which is going to be fatal mistake number 4, and then we're going to have 2 more. And hopefully all this information I'm giving you is helping you to become a better student nurse and ultimately become a better nurse when you actually get into the field. But that's it, guys. So until next time, study long and study strong. Peace out.